Welcome to the body imaging cases. The present case is a case of uncontrolled bronchial asthma diagnosed 20 years ago. There has been one recent episode of hemoptysis. There has been chronic rhinosinusitis. The chest X-ray and the preoperative CT have been done before anterior abdominal hernial repair. There has been no previous surgery. We are looking now at the CT of the abdomen and pelvis following our scheme of viewing the CT of the abdomen and pelvis. We are going to stop at three stations. The first is the pancreas, which appears fatty, although its volume as a whole is well preserved. You can see also the skeleton of the pancreatic duct system. You can see the main duct and the side branches of the pancreas. The splenic vein, which is a normal posterior relation to the pancreas, is seen here as if it is in a lake of fat, surrounded by fat from all sides because of the fatty replacement of the pancreas. Let us have a look now at the vasa differentia, as we have done in case 5. That is exactly where we expect them to be. You see some calcification here on the right side, and you see that the spermatic cord becomes very small on the right, and until it completely disappears together with the vas difference in the middle. Here on the left you see still the spermatic cord with its fat content and some vessels here and there, but the vas difference is quite atrophic. Going to our third station, the lower part of the thorax, we notice here that the bronchi have very thick walls. And some of them are quite logged with secretions. So they look exactly like the adjacent blood vessels up to the formation of a frank bronchocoel. The chest X-ray shows that the bronchovascular bundles are more dense and more numerous than normal because the bronchi, which are normally radiolucent, start to have shadows when their wall is thick and when they are logged with secretions. Bronchocoel is seen here at the upper lobe. So do we need to challenge the diagnosis of bronchial asthma in this case? This diagnosis has survived for 20 years. The answer is yes, based on two features which are quite specific for cystic fibrosis: the fatty replacement of the pancreas and the atrophy of the vasa differentia. Back to the history, we know that this asthma, between brackets, has not been well controlled. And we have also chronic rhinosinusitis, which is one of the recognized clinical features of cystic fibrosis. Cystic fibrosis is a disease of thick secretions, and it manifests by the thick secretions at the organs which are most clinically relevant, the bronchi, the pancreas, the seminal fluid, and the secretions of the paranasal sinuses. Cystic fibrosis is very well known as a disease of childhood. Occult and mild forms, however, do exist, and the diagnosis of the present case is mild cystic fibrosis. I have used here the term atrophy of the vasa differentia. This is not the term you will find in the literature. You will find there congenital unilateral absence of the vas deferens, CUAVD, when it is unilateral, and congenital bilateral absence of the vasa differentia, CBAVD, when the condition is bilateral. In fact, these terms are misnomers because the condition is not congenital, but occurs at variable points of time during the patient's life due to the thick seminal fluid and its effects on the vasa differentia. In fact, this 65-year-old patient has already had children, although his vasa differentia are nearly non-existing on the present CT. This means that they have been patent and functioning and normal in his adult life, and that the process has been an acquired sort of atrophy. It is a disease of thick secretions, cystic fibrosis, and that's exactly the same as what happened in the pancreas here, because the acini will atrophy and the pancreatic parenchyma will be replaced by fat in response to the inability of the duct system to deal with the very thick secretions. These are our learning points, and cystic fibrosis is very well known as a disease of childhood, but mild or even occult forms of cystic fibrosis exist, and mild forms may be mistaken, as in this case, for bronchial asthma. Fatty replacement of the pancreas and congenital unilateral absence of the vas deferens or bilateral are two features of cystic fibrosis which are well seen on CT. They may give the clue to the diagnosis in occult cases. The next case is an asymptomatic young lady who had a chest X-ray done to renew her work license. The chest X-ray showed a left paravertebral shadow, and CT of the thorax has been ordered to clarify the nature of this abnormality. The CT scout and the chest X-ray have dramatically different findings, although they are just a few days apart. First, the paravertebral abnormality is less obviously seen or nearly non-existent on this scout view of the thorax for CT. Second, you see here a new abnormality, which was not there before at the right paratracheal region. So brainstorm the possible causes of these abnormalities until we meet the next time.